Electrical stimulation is one of the most commonest modality used when it comes to Bell's palsy rehabilitation. But do you know that it comes with the risk of synkinesis if electrical stimulation goes more than required? That's why I have come up in this video with some electrical stimulation alternatives that are far more safe and yet equally effective when it comes to your Bell's palsy recovery. So, if you who are someone who is suffering from Bell's palsy and you don't want to go through that risky route of electrical stimulation, then what are the alternative ways? I'm going to explain that exactly in this video. So, make sure to watch this video till the end. Let's begin. Friends, when it comes to the research around Bell's palsy rehabilitation, electrical stimulation has gained a lot of popularity and is also one of the most commonly used modality for helping people suffering from Bell's palsy. Whereas there are certain research papers in which it has been identified that when this electrical stimulation is done more than required, it can lead to a secondary complication called as synkinesis. And unfortunately, synkinesis is far more difficult to treat than Bell's palsy altogether. That's why when we work with people who come to us with Bell's palsy, our aim is to minimize the synkinesis as much as possible. And that's why we never recommend or give electrical stimulation to our patients. So then what we use? What is the alternative to it? That's where sensory priming comes into the picture. What is sensory priming but? Well, sensory priming is a concept that is used in neurorehabilitation to stimulate or else facilitate movement on a paralyzed muscle. Shall I tell you one fun fact? Even the electrical stimulation also come under the category of sensory priming or else motor priming. Now, the principle or fundamental of sensory or motor priming is that to use your sensory system to train your nerve and your brain to move it, because we rely a lot on our sensation to move. When you will get some feedback from your touch sensation, from your vision, from the smell, from the things that you listen to, based on the understanding that the brain will accumulate from these sensations, the brain will plan out and map out the movement that will eventually takes place. So, if the input of information is going right, the output will also go right. That's why sending the right kind of input is very important, and that's what sensory priming does. So, what exactly is sensory priming? Sensory priming will use different methods. For example, stroking or else tactile stimulation, which means using the hand for doing different strokes of massages on the face that is aligned to the course of facial nerve. Number 2 is using vision as a sensory feedback provider to move the facial muscles. Number 3 is your auditory feedback. Number 4 is your proprioception. What is proprioception? Is the position of a muscle in relation to the environment. And number 4 is vibration. When these type of stimuli is given to the facial muscles, they will eventually activate and send the signals to the brain, because the sensory nerve, which is the trigeminal nerve on the face, is completely intact when it comes to Bell's palsy. So when the information that goes right, the brain can process it well and can plan the movement also well. For example, if you use your hand and give the sensory feedback that your cheek muscles position is this, while doing this practice in front of mirror, you are giving a visual feedback, at the same time a sensory feedback to your brain that this is the alignment or this is the neutral position for your cheek muscles to be in. This information, when goes, the brain keeps on processing, and whenever the nerve will start coming back to normal, the patterns will stay intact and your movements will also stay more aligned. On contrary, if you go with a traditional electrical stimulation approach where the muscle is stimulated so strongly that the contraction becomes visible, this contraction when goes more than required, then the brain tend to accumulate information that this muscle needs more force. because that's what it is accumulating, that's what it is processing. And this, I'm not talking from my mind. There is in fact an actual research that is done for Bell's palsy patient, in which it was checked that when the patient with Bell's palsy, MRI was taken before and after, even the Bell's palsy got over, their brain's thalamus were still active and were sending more signals than on the non-affected side. The link to that research, I'll put it in the description so that you can also read for your information. That's why doing sensory stimulation where there is no physical strong contraction on a muscle that is paralyzed altogether, at the same time we are using all the possible input systems to give right information to the brain, is an ideal way and safe way to encourage or facilitate movements on the face. And if you think that electrical stimulation heals the nerve, then please don't believe in this myth, because that's not true. Electrical stimulation never heals a nerve. Healing is an internal process, and that eventually is dependent on what time you take your medication. Are the medication taken in the right dosage? That's where your medical management comes into the picture. It has nothing to do with the electrical stimulation. Electrical stimulation or any kind of stimulation in that case is to facilitate the movements on the paralyzed muscle. That's the only role. The role is to ensure that the right information goes to the brain muscles. There is a good muscle memory that is maintained, and the reaction also comes in a natural way. So now let me show you some simple sensory priming methods that you can use. For example, I want to facilitate my forehead muscle. The easiest one will be this tactile stimulation by stroking my hand in upward direction, this way. Similarly, I can use a paintbrush and stroke it upwards. I can tap this area. I can even apply some gentle pressure on these muscles. I can apply some vibration on this area using an electric toothbrush or else a gentle vibration massager that comes for the face. Or else I can just use my hand and practically passively move the forehead muscle and feel the movement. At the same time, if I do the same practice in front of mirror and then do this, then again it will give me a sensory visual feedback, at the same time sensory proprioceptive feedback, which is going to be very important for my movements to happen. Now please remember, this particular information that I talked to you about right now applies only in the early phase of Bell's palsy. If you are in the mid phase of Bell's palsy or else you are in the late phase of Bell's palsy, please don't follow the stimulation approach, because the treatment varies depending on what is the muscle mobility or muscle strength or muscle movements that you have achieved at that stage. That's why don't ignore your Bell's palsy and think that just by watching one YouTube video, I would be able to do my exercises and I will be able to heal my Bell's palsy. Take a professional help, and if you want help from us, then feel free to reach out to us so that we can help you better. On that note, I'll end this video here and I'll see you in another video. Thank you.